Okay, we are connected with our speaker online. So, good afternoon once again to all of you and welcome to Plenary 8, entitled Every Breath We Take. It's inevitable that you will think of a song, Every Breath You Take. Um, as I got older, looking at the song and looking at the lyrics, it's a bit creepy though. Every breath you take, every step I'll be watching you. In some countries, this is now an offense, in Malaysia too. So good afternoon and welcome to Plenary 8, Every Breath We Take. I think this is going to be a very interesting and rewarding experience for all who are here. So the format is very similar to all our plenaries thus far. Give me an opportunity to introduce our panelists, and then I will also introduce our moderator for this session. First to say that our first panelist will be connecting with us online, and we hope that everything works. It's very technical because my assumption is we get to see our first panelist in order of who I invite, that is, online, and at the same time, she would be able to hear us. And later we would be able to engage with a discussion and it would be all captured. And I'm not sure, but I think we are also connecting with those online. So allow me to then introduce our panelists. The first person that we have is Dr. Maria Neira, and she joins us online. Dr. Maria Neira is the Director of the Department of Environment, Climate Change and Health at the World Health Organization. And prior to that, she served as Undersecretary of Health and President of the Spanish Food Safety Agency. Joining Maria would be Mr. Owen Pinnell, and Owen is an award-winning journalist and filmmaker for the BBC. Owen has a track record of making impactful investigative documentaries that lead to real change. Also with us this afternoon is Professor Dr. Arvind Kumar, who is the chairman of the chest surgery and lung transplantation at Medanta Hospital in Gurugram. Moderating this session is Dr. Helmy Mydin. Helmy is a pulmonologist and heads the lung center at Pantai Hospital, Kuala Lumpur. Pantai Hospital is a private healthcare facility in Kuala Lumpur. He is the co-founder of Asthma Malaysia, an NGO advocating greater empowerment for patients and asthma. One of 20 global recipients of the Inter-Academy Medical Panel's Young Physician Leader Award, Helmy was appointed as technical advisor on tobacco control and the special advisor to 2 previous health ministers. He continues his work on policymaking via his role as Senior Policy Advisor for Social and Economic Research Initiative, a think tank that focuses on issues related to inequality. So, ladies and gentlemen, would you join me in welcoming Owen, Arvind, and Helmy on stage? And Maria online.
Thank you for the kind introduction. Assalamualaikum and good afternoon. Thank you all for coming for this post-lunch meal. So we'll do our best to ensure that you don't fall asleep with the whole postprandial situation where you're a bit snoozy. But thankfully it's not Ramadan, so you can have coffee if you need to. We are in Malaysia, where basically we get a little bit upset over air quality about once a year, whenever it's a bit hazy. So when there's the particulate matter that is hanging in the air, which we see, we start to point fingers, usually at our neighbors across the straits. So that, I think, in a nutshell, tells a lot about the situation in terms of how we deal with pollution. But pollution, in terms of what's in the air, is very new. It's not very new at all, rather, because we have had it with London with the smog. We've had it with lethal air quality in LA. I was just chatting earlier on about the situation in Delhi and other cities in India. And Beijing is a recent example where things were rather horrible, but there's been some changes in terms of policy that has allowed for things to change. So I think that gives you a bit of an idea of how much of an issue it is, because there are different challenges. Although there are lots of studies, lots of research going on, different countries will approach this differently. And for emerging economies especially, there may be a bit of a challenge in terms of putting across what is necessary versus other interests and other options that are on the table. So having said that, I think the first and most important thing that we need to do is to get a little bit of an overview. And I can't think of anyone better than Dr. Maria Neira. I think that was a little bit of a introduction earlier on. But just to add to that, Dr. Neira is a medical doctor by training, and she's a specialist in endocrinology and metabolic diseases. And she does public health alongside her current role with the World Health Organization. Prior to that, she was also a medical coordinator working for MSF, and she spent several years working in Africa in various places with armed conflicts. So here we will have someone give an overview in terms of regulation and the global perspective. And then we have Dr. Arvind, who is a surgeon. So he actually literally looks at lungs, and you actually can physically see what's going on inside our bodies. It's something that I think not many of us will have, or well, rather be a bit squeamish about. But sometimes you need to know what's in front of your eyes, or rather what's in your chest, in order to have a little bit of an understanding of the dangers that you are facing as an individual. And then beyond that, I think all of us here are people who are passionate about this topic, but perhaps not many people outside are. And that's where communication, media, and journalism plays a very important role. And for that, we are thankful that Mr. Pinnell is here, Owen, if I can. And he will be talking a little bit about his approach to communication in terms of the issues at hand, how to translate science into something that's a bit more palatable to the public. So, Dr. Neira, if I can start with you, perhaps with something a little bit basic. There is this kind of saying or thought that within every crisis lies opportunity, and we are dealing with climate crisis, we are dealing with a health crisis. Could you start by just talking a little bit about what the crisis is when it comes to health in relation to the climate crisis? And are there any opportunities when it comes to how we can utilize this crisis to help promote public health issues?
Thank you, and good morning from Geneva. Good afternoon for you. A pleasure to join you virtually. I will love to join you there and have the opportunity to see all friends and participating in this fascinating dialogue. You started by saying that, in Asia, you know very well what the bad quality of air is about it. And I'm sure that Dr. Kumar will give you how you translate that into your lungs and the rest of your body. But let me tell you at global level, what we are seeing here and what is the context and how this situation needs to be absolutely changed. I'm very happy to see a former journalist, a journalist from the BBC talking about the bad air, the bad quality of the air we breathe, but because part of the solutions are coming with a very strong and good communication. The moment people will understand that when we talk about climate change and the mitigation of climate change, we are talking about air pollution and the solutions we can bring for air solution. We are in front of one of the biggest public health problems ever. The fact that we have more than 7 million premature deaths occurring every year due to the bad quality of the air we breathe. How can this be possible and not having a crisis solution here, an opportunity to change this completely is something that I don't understand yet. But this is the situation. Most of the people around the world is breathing air that is not respecting the norms that from a health point of view, WHO is promoting, the famous air quality standard. So how can we change that? How can we transform this in an opportunity? We said that anytime we take action to mitigate climate change, anytime we implement the Paris Treaty, the famous Paris Treaty that all countries at the COP sign, this is an opportunity to do public health. And one of the immediate benefits of implementing this Paris Treaty will be the reduction on air pollution. This is what we call the health argument. We are bringing this health argument to the COPs, now COP29. We are bringing the weight of the health that is suffering. We are convinced that only by bringing this health argument, we can transform those huge crisis that we are confronting now, and hopefully mobilizing the youth, the society that is now not aware of how climate change is affecting their health, but they will see relatively easy how air pollution is affecting their health. At the moment we are talking, the European Commission is changing the air quality standards. This is a very political debate, but they are moving in the right direction. We see in other places that legislation is starting as well to change a little bit. This will require enormous societal changes and approaches. But if we mobilize the communities on their understanding how this is affecting my health, the health of my children, how many cases of asthma we can prevent, how many cases of lung cancer we can prevent, the cost that this is represent for the health system, and therefore for those who says that investing and changing climate change will be very expensive. Here you are. I mean, we are already paying the price. The investments are already there, but in the wrong direction. We need to do a transition in a way from those fossil fuels, the combustion of fossil fuels that are literally killing us. And as you mentioned, in China, we have good results. So the proof is that we can change it. We can modify all of that if we take the right political decisions, and we are investing on it. But with the results on the investment will be multiplied enormously, the benefits, not only for the health of the people, but for the economy and for a more sustainable development. So the health argument at the COPs, at the climate change negotiation, is the health opportunity we are looking for. And we are trying to make sure that everybody will use that health argument on taking very decisive actions that we need to take right now. Legislation will help us as well, and we need to use that argument more. Yeah, we hear you.
Hello? Okay.
Yes.
Sorry. So Dr. Neira has given a very nice overview about things from a holistic global perspective. And just before this session, I had the pleasure of chatting with Dr. Arvind, and basically he does everything in your chest, right? If you have any problems, any growths or lack of anything in the lungs, that he seems to be the guy that you go to. So obviously you've had lots and lots of exposure and lots of work in terms of managing problems with the lungs. So why are you here? Why are you leaving all those diseased lungs behind? Why fly all the way to Malaysia and run the risk of being stuck in
air pollution?
Yeah.
First of all, a very warm good afternoon to all of you. My thanks to Sunway system. I wouldn't call it university or center. It's a system. It's not even a city. It's a whole ecosystem, beautiful ecosystem. So thanks to everyone here, and thank you for the kind words. This is an often asked question. Can I have the pictures now? Yeah. So this is an often asked question. What is a chest surgeon doing in an air pollution conference? Well, this goes back to about 15, 20 years back. As a part of my job, I open about 3 or 4 chests every day, and I look at lungs and take out the diseased lungs and whatever surgery. Around 2000, so lungs, when we are born, lungs are nice and pink in color. That's an image you would see on your left. The pink picture is a lung that we are born with. There are no black spots. It's a very pristine looking nice organ. And before 2000, I used to see black dots on the lungs of smokers, which was understandable. And when I was operating for other diseases or I was operating on children, it would be black lung. Then slowly, I started seeing a little bit of black lungs on black spots on the surface of non-smokers also. And over the first 10 years of the 21st century, I saw that these black dots were becoming bigger and bigger, more in number, occurring in more number of people. And the worst and most hitting point was when I started seeing them in children also. Around 2012, I moved from a government institution, which used to have people from all over the country, especially from rural areas also and hilly areas also, who had better lungs. I moved to a private center, which was catering mainly to Delhi population, which was exposed to. And suddenly, I would not see a pink lung at all. Whether smoker, non-smoker, it is black, black, black deposit. The picture you see in the middle is the lung of a typical Delhiite non-smoker. and the picture to your extreme right is if he's smoker as well, then this is the kind of picture. And my turning point was when I saw a series of teenagers having similar deposits. And then I thought to myself, my God, if this person has got these black deposits in teens, what will happen by the time he reaches late 30s, if at all he reaches that age? And that was a moment of reckoning for me. And I thought, this is a silent damage occurring inside people's body, which they are not aware of because nobody can see inside. And God has given us so much of extra capacity that unless 70% of your lung is damaged, you may not really experience any significant symptom. So it was a point where I had to decide whether I digest this information and continue to operate inside the OR, or I take these pictures and come out into public space and spend my time more on preventing the diseases that I was treating rather than just continuing to treat 3-4 patients a day. And I chose the later, that no, I must come out with these pictures into public spaces and share with the world, because no one except a chest surgeon would ever have access to these images. And since 2015, I founded Lung Care Foundation, and then we started a group called Doctors for Clean Air to share these pictures. And I've traveled across the globe and shared these pictures. And I would request all of you to take these pictures, because I believe that this picture needs to reach every human being on this earth, that friend, this is what air pollution is doing to your lungs, and more importantly, your children's lungs. And if you do care for your children, which most of us claim to, then you cannot ignore this topic. That's what brings me in this space.
Thank you for sharing that. I think that's very powerful. And I think alluding to what you're saying, there is a lot of power in images.
Yes.
Yeah. So you take something abstract and then you visualize it and you see the impact, right? The physical
In fact, that
impact.
was the reason I requested for these pictures, because I was told that this is a slide-less session. But there's no way I could have described these pictures in words. And that's why I'm grateful to the organizers for the permission to show these pictures. Thank you so much.
So we can have one slide, but we can't do documentaries or shows, I'm afraid. Having said that, at 4:30, these two gentlemen will have another session in this room, and we'll actually be seeing a clip of a documentary that Owen had made. And this is quite interesting because we see documentaries about war, conflicts, about the climate, but not much on the impact of the environments on your breathing. And you had one documentary called Breathless. So what kind of made you go into this particular space?
That's a good question. So yeah, I was interested in doing a documentary about climate change, but my remit at the BBC is looking at stories from the Middle East, and in general, actually, we kind of did some surveys, and there's not a huge amount of interest in stories about climate change in the Middle East, unfortunately. At the time we were...
Something to do with something under the ground?
Something about that maybe. But, you know, people were more interested in stories about health. So, you know, we were thinking about that. And at the same kind of time that we were thinking about that, coming across my Twitter feed as I was just mindlessly scrolling were these sort of overroaring images of huge flames just completely dominating the skyline in southern Iraq. And those flames were coming from oil and gas industry. So Iraq, as you know, has a huge oil and gas industry, but it also has a massive problem with gas flaring, which is just burning all of the excess gas that comes up from oil production. And people who are living in these areas were upset and worried about what was the effect of these, you know, of these flares on them, on their health. But there was kind of an information black hole about that, in terms of, you know, the government sort of blocking open information and health data, and no real pollution monitoring of any sort. So yeah, we wanted to find out, you know, how it's actually affecting people. We knew about that people were worried, but we kind of thought, you know, this is something we should actually go and meet people from these communities living around the oil fields. And also from just like a very basic like filming point of view, the flames were quite cool. Like it kind of looked like an action film, seeing these massive flames. Obviously, we knew they were very, very dangerous for people's health, but you know, in terms of what they would look like in a documentary, we thought this is a ideal filming subject. So when we went to Iraq, we found a really devastating picture of local communities around the oil fields where they said cancer is like the flu here, because so many people were getting sick as a result of the air that they were breathing. And we went to a children's cancer hospital where we met young children with leukemia, who were, many of them living extremely close to these oil fields and close to the flares, sometimes within 500 meters of the flaring. We met Fatima, a young 11-year-old girl living next to an oil field run by the Italian company Eni. And she painted, she was a keen artist, and she painted her house. And in this painting of her house, she actually drew the flares on either side. And she told us that she's always staring at the kind of flickering of the flame. And she had made the connection herself between how sick she was and how sick others in her family were, and this proximity to oil and gas industry. We also met Ali, an 18-year-old who was living next to BP's massive oil field in southern Iraq. And he told us that he dreamt of the oil companies going away so that he and his and others in his village could play and live in peace. And so for these children, like the link between the air pollution and their health was really obvious, but we wanted to try and prove the link in a kind of vacuum. So we worked with a local scientist at Basra University, Professor Shukri, who did an incredible job basically bringing pollution monitors in a kind of citizen science type way. These monitors weren't available in Iraq, but we were able to kind of smuggle them in to the country, and Shukri went around these local communities distributing these pollution monitors. And I mean, the results won't be surprising to anyone in this room. There were extremely high levels of carcinogenic, volatile organic compounds, which are released as a part of these this fossil fuel industry as part of flaring. And people were angry when they got the results. You know, they were saying, why should we pay the price for the oil companies' profits? And you know, a feeling of powerlessness as well. Like, you know, how can I protect my children from this situation? And obviously, the reality is that we're all, you know, around the world, people are benefiting from the cheap fossil fuels, but the cost of it is borne by those communities who are living around the oil fields and being sacrificed essentially for the oil. So that was what our documentary was trying to, you know, communicate and show.
Did that lead to any policy change or any changes on the ground?
So so far there hasn't been as much change as we would have liked to have seen. The Iraqi government was sort of pointing the finger at BP and the foreign oil companies, saying they need to raise their game. But unfortunately, so far the BP and other oil companies' response has been quite weak. There hasn't really been any changes. And sadly, the young man I told you about, Ali, the teenager, he died actually around a year from today. And his father attended the BP AGM and actually put the question to the BP CEO, you know, what are you doing to stop more children like my son from dying as a result of your practices? And, you know, the response was quite sort of mealy mouthed, unfortunately, and didn't really take us anywhere. So we're still hoping for change. We've had a lot of strong words of condemnation, but real change we're still hoping for.
Having said that, stories like what you're sharing with regards to Ali and Fatima are very powerful. There's the whole thing about one death is a tragedy and a million is a statistic. And earlier on, Dr. Neira, you mentioned that 7 million people die every year prematurely as a consequence of air pollution. And I think Owen's kind of highlighted one of the challenges whereby we may have facts, we have data, but it can be quite difficult to push the right policy changes at a government and a global level. Dr. Neira, would you be able to share what seems to have worked and what hasn't in terms of adoption of these policies, in terms of what you've seen across the globe, and if there's anything that countries like Malaysia, for example, can learn from the experiences of others?
Thank you. I have the privilege to see the documentary, and I have this gives me the opportunity again to congratulate the BBC team for this documentary. Very powerful. We have the opportunity to show it at the COP. I think it was the 27, if I'm not wrong. And as you describe, we don't see the responses that should be taken, looking at the magnitude of the problem. I think this type of documentary show the linkages between climate change, air pollution, and health very, very clearly. We have others as well. I think all of you know the case of the little Ella Kisidebra in London, where for the first time ever on a death certificate, we have as a cause of death for this little girl, air pollution and not only asthma cases. Asthma has been one of the, it's very painful what I'm going to say, but asthma has been a kind of opening eye for this challenge that we are confronting on climate change and air pollution, because people link very well, can link very well the fact that you have an asthmatic child and then the bad quality of the air you breathe. Things that are working, legislation, clearly, but it's still very, very weak in many countries. It works when you have mayors. The mayors can change enormously because they are very close to the population and they depend very much on their votes. So if we can provide to the mayors with the positive arguments and saying, if you take this measure in terms of putting in place a sustainable transport system and reducing the traffic and therefore the air pollution in your urban area, those are the deaths you can prevent or the diseases you can prevent. So if we can provide those positive arguments to policymakers at local level, I think this is one of the interventions that works, making sure that local municipality, local policymakers, mayors are taking those measures. Some of them are very unpopular because are related to ultra low emission zones or reducing the traffic, removing certain type of cars. The most powerful one is talking as well with the parliamentarians and the congresses and the governments and asking them to incorporate the air quality guidelines of WHO and use it as a kind of legislation and be penalized if they don't reach the levels that are required, and they need to even pay some sanctions for that. This is happening in some countries as well, and we are moving in some direction. And of course, the political level on arguing as the health professionals, we need to keep very strongly leading the transition to renewable, clean sources of energy. As we did as a health community many years ago on pushing for having access for our populations to water and sanitation, and that was a very strong cause for the health community. Now our health cause is arguing for transitioning to clean sources of energy, renewable sources of energy. This is a big mission for the health community, and we are therefore training doctors, health community, making sure that they understand that their role is not just at the hospital, as Dr. Kumar was doing, and treating patients, which is extremely needed. Please don't abandon the hospitals and the treatment, but we need their voice as well, very strongly describing what are the health consequences, or if we want to put it in positive, what could be the health benefits if we go for this transition to clean sources of energy. This is our cause, and this is something that is working, mobilizing the health community, legislation, making sure that people understand that this is about health. when we have mothers and grandmothers mobilized because of asthma, believe me, this is a movement that is unstoppable and irreversible. And of course, keeping on the science and the global advocacy and demonstration with science that this is very, very effective and we need to move.
Thank you, Dr. Neira. I'll just read an excerpt from Al Jazeera with regards to what Dr. Neira was alluding to about this case, right? Ella Casey Deborah's little body could take it no more. In 2013, the 9-year-old died after an acute asthma attack after living the whole of her short life 30 meters from London's busy South Circular Road, with repeated visits to the hospital following multiple and frequent seizures. The coroner pronounced in 2020 that the toxic fumes she had breathed because of the traffic on the roadway were partly to blame, and this was the first known instance of the law recognizing air pollution as a cause of death. And one can imagine that this is happening across the globe, even in countries like Malaysia. Now, patients don't always listen to us, as you know, Dr. Arvind. Do politicians listen to you in India?
Yeah, they do listen when you're talking to them in private. They listen very attentively. They promise a lot of things. But then when it comes to policy making, and there are counter efforts also by, so you want them to make certain policy and there are certain other lobbies which want them to make other policies, then things change. What I want to convey is that, if I may just for a minute digress from the topic. So the images you saw in the lungs, many times, and this is something I wanted to state here, a lot of people, and sadly, including a lot of doctors, have this notion that this damage which air pollution causes is confined to lungs only, because we breathe, it goes into the lungs, so everybody feels, yeah, asthma and all lung cancer, all kinds of. No, the portal of entry is lungs. But these particles, which may vary in size from large to small to ultrafine, and also apart from particles, you have chemicals. They go and deposit in the lungs, they stay there, they get absorbed into the bloodstream, and through the bloodstream, they go to every organ from brain to toe. And the saddest part of the story is that now there is enough data to suggest that this damage does not wait for us to be born and breathe. The damage starts even before that, when we are in the womb of a mother. So when a pregnant lady breathes polluted toxic air, that toxins cross her lungs, go to her blood through the placenta, they go and damage the fetus. There is recorded evidence that congenital effects, intrauterine growth retardation, intrauterine death, premature delivery. So there is a huge amount of damage which is occurring even before we take our first breath. And then when we come out and we take our first breath, we don't have any other air. You're breathing the same air. So in my city, if PM 2.5 is 250, which is to about 10 cigarettes in terms of damage, a newborn who breathes in the first 24 hours breathes equal to about 10 cigarettes. So I always say on televisions that in a polluted city, newborns become smokers. A polluted city has newborns becoming smoker, and that's precisely the reason we are seeing a high incidence of lung cancer in polluted cities, because your exposure starts at day one. So by the time you are 30 years old, you've been exposed to toxins for 25, 30 years, and your tissues are. So we are seeing more lung cancer. We are seeing more lung cancer in so-called non-smokers at a younger age, in women, and all these are extremely disturbing times. But apart from that, brain problems, heart problems, kidney problems, all kinds of cancer. And the worst news is it is even affecting the IQ development in children. There is enough data that IQ development, lung development is retarded in children who are exposed. So I think it's a generation which is being affected. So there is disease, disability, and as Dr. Maria mentioned, millions of premature deaths. So amount of damage being caused is colossal. Unfortunately, public is not aware of it. And I think that's where doctors across the world have a huge duty for two reasons. One, we see these impacts ourselves and it motivates us. That's why I'm here. So like that, all those who have experience in their outdoor clinics, they are more motivated to do something about it as compared to someone else. One. Two, when we talk to public that it's a health issue, so when a lady comes with her child and he's got pneumonia and you say that this pneumonia is because of exposure to air pollution, you know that they will listen to you. So I call doctors as motivated motivators. And I strongly feel that there should be a movement across the globe where doctors should put up a standee in their clinic which just says 2 words: in polluted cities, or the 4 words: in polluted cities, breathing kills. If you put this standee, it will start a dialogue. People need to be informed that your next generation is getting maimed, diseased, dying early because of this. How can you not act immediately? And this works. We had this Supreme Court case about crackers. We have a National Green Tribunal where we have gone, and I have gone to the courts and shown these images. I'm not saying a lot of things change, but at least some impact. If we as doctors come out of our clinics and go and present this evidence again and again, I've gone and shown these images in Parliament. We've given it to members of Parliament who've shown it. It does have effect, but it will need a huge amount of hammering, continued effort, and people across the globe to get agitated and turn it into a movement where instead of politicians forcing it on people, people should demand it from the politicians. And that's when the change will come.
In many ways, you're describing what needs to be done that has already been done by doctors for tobacco.
Yes.
And it's taken
Yes.
decades.
Nuclear disarmament,
Mhm.
also doctors
Mhm.
played a major
Yeah.
role. Tobacco, they played a major role. And now I think time has come where for a third time,
Mhm.
they have to play a major role in saving people's health and planet's health.
So he talked about agitation, right? So how do we agitate people through social media or through images or through documentaries above and beyond? Like I mentioned earlier on, sometimes people don't listen to doctors all the time, but then we watch TV, we watch Netflix and all the streaming services, and we watch BBC. How can that be done, I suppose, in a more structured, organized fashion that will allow for a campaign that perhaps is quite similar to what we did with tobacco to be more prevalent so that we can reduce this issue with regards to health effects from air pollution?
I think, yeah, it's a really good question. I definitely don't have all the answers to that one, but I think I guess where we started was trying to humanize the issue and basically find the kind of human heart of those kinds of stories. So, the individuals, as you said before, one death is a tragedy and a million is a statistic. So I guess that's a pretty important way, is just telling people's stories and allowing people to tell their own stories as well. I think one thing that was really powerful was just giving Ali, the young guy from southern Iraq, the camera himself, so that he could just film his daily life and show the situation and what he was exposed to in terms of air pollution. I think that was really powerful, and I think social media has enabled that to happen really widely. But I guess another thing to be really cautious about is just the idea that this is a problem for someone else and not a problem for us. And so, even though this is in southern Iraq, there are sacrifice zones, in the sense of which, as I understand it, means places where people's health is put second to the pursuit of profit and resource extraction. Those places exist all around the world, and I suppose telling those stories, which are often kind of they're ignored quite often. I think telling those stories is really important, and I think that people are interested in hearing those stories, and that they are in the global north as well as the global south. There are places in the US where and the UK where people are also having suffering from the effects of fossil fuel air pollution, and so as we talked about Ali Kissi Deborah and her tragic death, I think humanizing it and bringing it close to home as possible, that's the answer in a nutshell.
Okay, thank you for that. We have literally 5 minutes left, so it's amazing how time has flown by. Are there any burning questions from the crowd? Anyone that would like to quickly ask a question while we've got our folks here going once, going twice? Everyone's happy to keep quiet. They'll send you emails perhaps later on. Oh, there's one here, please.
So, we hear from, I guess, our grandparents, that in the old days, they thought going up into the mountains and, getting a good dose of fresh air, was a good thing. And I have a cousin from London who tried to take a job in Hong Kong and is asthmatic and had to come home. He couldn't live there. So what I'm wondering is to look at the how to live with this situation while we are healing the planet. Is there benefit to taking your children into fresh air? I know in Mexico City, because of the terrible air quality, families will try to get their kids out on the weekends. Can those spots on the lungs be, does the body expel them? Can children be healed if they are exposed to poor air quality? And what is the role of just being in clean air in nature as supplemental to or even an alternative to medical procedures?
Shall I? Excellent question, ma'am, because again, there's a lot of rumors being spread by different agencies that, oxygen spas are now becoming very popular, that you pay a certain amount of money, 15 minutes of oxygen, clean your lungs. That's how it's being projected. So the fact is that these deposits, once they are deposited into the tissues, they are part of the tissue. They cannot be removed. Number one. Number two, going to cleaner areas in mountains with cleaner air would reduce your exposure for that much period while you are there. So Monday to Friday, you are in Mexico, and Saturday, Sunday, if you are elsewhere, probably it will reduce your exposure to 5 days a week instead of 7 days a week. But whatever damage has happened in those 5 days will not be reversed by not getting exposed to the next 2 days. So going to cleaner areas, taking oxygen therapy, all kinds of nutrients are now being promoted, that if you take this, food, supplements, etc. The fact is that once these deposits are there, they are there. They cannot be removed. So best is to prevent them. Yes.
I always joke with my patients, I can prescribe you inhalers, but I can't prescribe you a move to Switzerland, which is unfortunately what we see in clinics when it comes to asthma exacerbations and people having bronchitis and things like that. Any other? Oh, there's one lady over there. Can someone pass the mic, please? Oh, there's one here as well. Okay, why not we take both questions? And I think by that point, we'll be done with time. Please, sir.
Thank you very much, and always a pleasure to listen to Dr. Kumar, Owen, and Dr. Maria, and thank you for the wonderful facilitation. I'm Harjeet Singh from Fossil Fuel Non-Proliferation Treaty Initiative. Dr. Maria did mention about the role of fossil fuels. Of course, the story that Owen did is about the fossil fuel industry, and Dr. Kumar also briefly mentioned. The point I would like to raise is I think we need to be far more explicit in actually telling the world that it's the fossil fuel industry that has caused the problem. Because when we say air pollution, somehow we are not talking about who the culprit is, who has caused the problem. We knew 50 years ago that fossil fuel burning is going to cause climate crisis. We knew that the health crisis is primarily because of the extraction and burning of fossil fuels, yet we are not talking about it enough. I think we need to talk about the industry which is responsible for the crisis or multiple crises that we are facing, which is profiting from the energy crisis, which created the energy crisis first and now profiting from it. Hundreds of billions of dollars are being made, yet we are not telling the world, and they are using all their different tactics to say, we are the ones responsible for this development. We are your development partners. No, you are not. You are killing the planet. You're killing people. You're killing children. You're killing women. I think that has to be talked about far more explicitly, and we should say who the culprit is. And as Dr. Kumar, you said, when you try to lobby governments to do the right things, you know the other side. I think that other side now has to be said. It's the fossil fuel industry. Our climate convention doesn't mention fossil fuels. Paris Agreement doesn't mention coal, oil, or gas. Do you think it's an accident? It's not an accident. We know the invisible handprint behind these agreements, not talking about it. It took us so much of effort to get fossil fuels at COP28 agreement. So I think the time has come when we have realized what the problem is and who has caused the problem. I think let's go full throttle behind that and make sure that they are held to account. Thank you.
Very true. Fossil fuels in all its forms, whether it's liquid, solid, gas, all the, a lot of people are projecting that gas is safer to the other two. It's not. So liquid, solid, gas, all three are culprits, and moving away from them fast and in an equitable and just manner is the answer. True.
Yeah, if I may, the World Health Organization has been very strong on that as well, saying that we need to phase out from fossil fuels because this is a health imperative, and we will be keeping doing that. And that's why we have such an interest on being at the COPs, because we need to tell those negotiators that are negotiating with Celsius degrees or the reduction of emissions. We want to tell them that they are not only negotiating with that. Their decisions will decide as well how many people is going to die with lung cancer, how many people will be exposed to the consequences of burning fossil fuels. So definitely, I fully agree. We need a white coat revolution, I think. And we are on it.
Thanks. Actually, it follows nicely from Harjeet's point. I mean, at the heart of all this, there's a political economy problem. There's a problem of power and the way in which fossil fuel companies not just thrive and profit from people's health at the expense of people's health, but also that they fuel the politics in a sense that prevents us from generating the political will to do so. So how do we shift that? And that has to shift and that is the role, I mean, I represent an alliance called the Global Commons Alliance, and in a sense, the media has to actually play its role, step up to the challenge, because unless we really expose and then change the system through showing the facts and evidence-based, science-based arguments that you're making, we won't get there. So just wanted to.
Yeah, no, that's a really good point. And I think, in general, as the media, we have to be brave enough to kind of name the culprits and hold those who are responsible to account. And I think, sometimes there's a nervousness about that because of the massive legal departments that some of these companies have and the threats that they're willing to make. I mean, I've definitely received these very scary legal letters that always come, the night before the story's going out, with lots of clauses telling you why you can't report on what you want to report on. But I think if we stick to the evidence and and the facts on the story, then there's absolutely no reason why we can't do our job of holding those responsible, those in power, to account for what they're doing to our health and to our planet's health.
Can I just add to that one sentence?
Sure.
I think the problem lies in that fact that till now, air pollution has been presented and discussed as a chemical issue and as an environmental issue, and the public at large has generally kept itself aloof. Oh, this is for the scientists, this is about the environment. Unless they know that it's hitting them and it's hitting their children, they will not do what they need to do. So I think there is a 3A approach: awareness, awakening, action. If you make them aware, it's not about the environment, it's about your child, your grandchild, then they will be aware, awakened. And when they are awakened to the danger to them, not to the planet, they will act for themselves. And then the actions will come in two forms. One, they themselves will take some actions. More importantly, they will ask for government to take actions. Governments will only take actions when it becomes a vote issue. That you take action and you get vote, not that you continue not to take actions and continue to get vote, which is what is happening today. Thank you.
I mean, I would love to have this conversation continue, but I think we can't end on a better note than that. Sorry, what's the three things again?
If you let them act the way they are acting,
Act.
then but if we ask them to act, maybe I've forgotten. it just came.
I hope it's recorded
just,
somewhere. Yes?
It just came
We
spontaneously.
should get that clip, right?
I'm so sorry. It came so awareness. It's awareness, awakening, action. Triple A approach.
I like that. To get that clip, Prof. Elil, we can share it out. So I think we should end there because I think we've run out of time. Thank you to the panelists, one from all the way from Geneva, and of course to our gentlemen here for your time. And thank you to the audience for participating as well. And I'll hand it over back to the MC.
Thank you. Just a quick photograph. Could we get a picture of our three presenters? I'm sorry, Dr. Neira, you're online, but you are here with us in spirit.
Pleasure. Thank you. Thank you all.
Thank you very much. There are others who want to join in the session in a short while, so we're mindful of those waiting.